participants for the webinar joining us. Thank you so much for choosing to spend your hour with us. We are going to get started momentarily. I see participants joining. I invite you to join us to share your name, your role, and the organization that you're representing in the chat box. We are super excited. We've seen the registration for the webinar and so happy that you're choosing to spend the hour with us to learn about our Building Healing Behavioral Health Systems Data to Action Toolkit. And I'm going to get us started because we have lots of resources to share and want to make sure that we have adequate time to share about the work that we're doing and talk with you about building healing systems. My name is Tiffany Beeson. I am an assistant professor at the University of Maryland School of Medicine, and I am very honored to be co-leading this work with my team and partners at the University of Maryland School of Medicine, the Bowie State University, and in partnership under the leadership of the Maryland Department of Health's Behavioral Health Administration, and specifically our program officer at BHA, Dr. James Yo. And Jay, if you want to come off camera and unmute yourself to greet the audience, I welcome you to do so right now.
All right. Well, good afternoon, everyone. It's a very exciting, and I'm really happy to see so many people joining us today for the launch of our Building Healing Systems Data to Action Toolkit. This is a fabulous resource a web-based resource that will be available. It was built in the context of a larger program of trauma-informed and healing-centered work for the public behavioral, targeting the public behavioral health system, but it's also useful in a much broader context. And we really hope that people will use the website, share it with others as much as you can. And I'm really happy to see this up and going, and it provides just a tremendous amount of resources, both on ACEs and positive childhood experiences, as well on, so what do we do about it? What are some of the resources and things we can do, both within our organizations and in our communities? And with that, I want to thank the University of Maryland team for all of their hard work on this, and I'm going to pass it back to Tiffany and we can get started with the overview. Thank you, everyone.
Thanks, Jay. And piggybacking on that expression of gratitude, I wanted to express gratitude to our Building Healing Behavioral Health Systems partners across the state of Maryland that we are working with to foster trauma-informed and healing-centered systems within our state. So as I mentioned, we are a partnership of the University of Maryland School of Medicine, the Department of Psychiatry, and there's representation of the Division of Child and Adolescent Psychiatry and the Systems Evaluation Center and the Bowie State University. And we are working in collaboration with the Maryland Trauma-Informed Care Commission and the various work groups under that commission, in addition to the Maryland Association of Behavioral Health Authorities, the Healing Systems Advisory Committee, and also, last but not least, people with lived experience within our various teams and within the community in Maryland who are lending their expertise and lived experience to the work that we're doing to build healing systems. Just for a bit of housekeeping, I wanted to share that we are offering continuing education credits and certificates of completion for Maryland licensed social workers, psychologists, professional counselors, professional therapists within the state. And we ask that you please complete the online evaluation that will be offered at the end so that we have your information. I wanted to acknowledge our team of experts that are supporting this Building Healing Behavioral Health Systems work. Here you see images of our team members that have expertise in areas of trauma-informed systems, research and program evaluation, psychiatry, cultural responsiveness, anti-racism and equity, strengths-based approaches, and I can go on and on. I just wanted to express gratitude to the team members who bring a lot of expertise, personal experiences related to healing systems. Here is a visual depiction of the work that we are doing, who's involved, the specific activities and outcomes of interest for this work. So who is involved? All communities. So we are doing work to support all Marylanders across all of the jurisdictions, all counties, including Baltimore City. And we are working to support the public behavioral health system with adopting trauma-informed practices. So we are including leadership across the state and the university partnerships. In terms of our activities, we will be supporting with data monitoring and analyses related to trauma, ACEs, or adverse childhood experiences, as well as positive childhood experiences. And we will be developing infographics, and the Data to Action Toolkit is what we are focused on today. We are also supporting with the development and implementation of a trauma-informed organizational assessment tool that can be used to support continuous quality improvement in the way of trauma-informed systems. We're offering training and technical assistance, all with the aims of supporting our state with developing common language related to trauma-informed systems work, to increase the understanding about ACEs and positive childhood experiences, to improve our systems and services, and ultimately support better health and well-being for all Marylanders. We are doing this work informed by core principles: trauma-informed, resilience-oriented, equitable care and culture, which are the principles of the Maryland Way. And from those principles, we focus on realizing the widespread impact of trauma and recognizing the signs and symptoms of trauma by also responding to our knowledge about trauma through policy and practice change, and working to resist re-traumatization. Our work is resilience-oriented in that we focus on programming and policies and practices that we know are proven to build resiliency. And we also are committed to systems change. So acknowledging the impact of racism and other forms of oppression on the experience of trauma and adversity for communities, so that we are changing those systems that require that people are resilient in the first place. And related to that, we center equity in our culture and care in everything that we do. And Joanna is going to be sharing some links to some resources in the Data to Action Toolkit that share more about the Maryland Way, or the TIRO model, as well as the trauma-informed, resilience-oriented, and equitable care and culture principles that were adopted by the Trauma-Informed Care Commission. And at this stage, I am going to pass the mic over to my co-director, Dr. Joanna Prout, to share more about the Data to Action Toolkit resources.
Hi, I'm Joanna Prout, a clinical psychologist and research manager at the University of Maryland Division of Child and Adolescent Psychiatry. And I'm very excited to be here with you today to introduce our Data to Action Toolkit that's been developed by the Healing Systems team. But I want to start off the presentation by talking about data in general and how you already use it all the time, whether you realize it or are thinking about it or not, and how you can build on these skills to build trauma-informed and healing-centered systems in your work and life. So often we think about data as just big numbers on a spreadsheet, but really data can be many things. It could be words or just things that you see around you. You're taking in lots of data from your environment all the time and using it to make decisions. For example, if you're at a group of restaurants or food trucks and you're deciding on a place to eat and you see one that has a really long line, you might decide to avoid it because you're in a hurry. Or you might decide that that long line means the food is really, really good and you definitely want to go. Or if you're in a group and you see people talking and smiling and looking at you, you might use that information to decide that it's a good time to go over and introduce yourself. So there's so much data and we're so used to seeing all of it and making decisions based on it without even really thinking about it, that sometimes we need to look at the world in a new way to really see the bigger picture. By zooming out, like climbing to the top of a mountain to look around, or zooming way in, like we're using a telescope or a microscope to see things that aren't immediately visible. And looking at data in a new way can help us see how things are connected, see relationships that might not be obvious at first. And once we can see and understand these relationships, we know more about how we can change one part to get a new or different outcome on the other part. So with this in mind, I'm going to take you through two quick stories of how people use data to solve public health problems. One that happened a long time ago and one that is much more recent. For the first one, I want you to think back to London, England in the 19th century. And there were often deadly diseases spreading and not much was known about how or why this happened. Most people, including doctors, thought that bad smells or miasma spreads disease. So they try to avoid things that smell bad in order to stay well, but it's not working well. Into this scene comes Dr. John Snow, a British physician that lived from 1813 to 1858. And during an outbreak of cholera in the 1850s, he used a map and noticed a relationship between where people got water and who actually got sick and got cholera. By using this grid to chart deaths from the outbreak and investigating each death to learn where they got their water, Snow developed what he considered proof that pumps in the water they provided were the source of the cholera epidemic. Because looking at his maps, he saw that people who got sick or died were all getting their water from the same pumps. A person who lived right next to someone who got sick, but who used water from a different source was often completely fine. And then he did convince city officials to block access to contaminated pumps, and the cases of cholera went down, but it took some time and a lot more research, including a better understanding of bacteria. But we know now that he was right and that cholera is caused by bacteria that exists in water. And this has led to a lot of public health breakthroughs that have saved a lot of lives. And for our next story, much more recent, thinking about where data has been used to make a change, is the shift from 911 to 988. So there was, for many years, observations that for most 911 calls, or many 911 calls, police were not really needed. And this over-reliance on police led to both an excessive use of force and many negative outcomes, especially for communities of color and other minoritized groups. And when research tracking 911 calls was completed, it showed that up to 40% could be better supported by people other than the police. This finding led to the development of the 988 Suicide and Crisis Lifeline, which was launched in 2022. While the rollout is recent and data is still being collected, the hope is that this shift will lead to better outcomes for both the police force, we can allocate resources more effectively, and the communities served. So with these two stories of using data to take action in mind, we would like to move to introducing the main topic for today, the Data to Action Toolkit website. So as we go to the next slide, it's going to tell you more. This is a website to give people the information and resources they need to take action and make change. We're hoping it provides information for people who are working at both a systems and an individual level. Some information is specific to behavioral health, but most or a lot of it is going to be broadly applicable to anybody working with people. And now we would like to invite you to, if you can, if you're at a computer, click over to the website at healingsystemsdata.org. And we'll also put that in the chat for you. Wrong thing.
Just added it to the
Got it in the chat. Pull the full URL if possible. Should be on link with the full URL in there now. And just to provide an overview of the content that you'll find on the website, it was important to us that we take a systems perspective as we created this toolkit. So we provide that background information and then move into talking about the impact of trauma and how we can work together to promote healing-centered systems and support resilience and equity. So we start with some foundational information about how systems impact people, both in beneficial and harmful ways, and how policies can play a role in shaping systems. To provide more context, we talk about social determinants of health, prevention, and discuss anti-racism, which is an important component of building healing systems. We fold in childhood experiences, both adverse and positive, and how a better understanding of these can help us support people throughout the lifespan. The toolkit contains a lot of information about trauma, what it is and how it may impact people, and how we can work towards changes that prevent it from occurring and support people who have experienced it. And since we're hoping this toolkit will help people who work to help others, we have included information about secondary traumatic stress, what it is, and how we can work together to minimize or eliminate its impact. And now it's my pleasure to introduce Summer Ray, a senior clinical research assistant who helped develop this resource. And she's going to tell you more about the Data to Action Toolkit and the specific content that it includes.
Thank you, Joanna. Hi, everyone. As you've heard from our previous speakers, one of the main goals of building healing systems is to create and sustain changes to make organizations more trauma-informed and healing-centered. With this goal in mind, some of our foundational content of the toolkit includes information about systems and policies and how they can affect people in both positive and negative ways. To make it easier to explain systems and their impact, we provide examples of both harmful and healing policies within different systems, such as education, justice, and more. If you click on the Systems and Policies tile on the homepage of the toolkit, you'll see a table with some of these examples. And one example that you'll see in this table is within the education system. Both policies are used in instances to deter unwanted behavior, but exclusionary discipline has shown to be a policy that is more harmful to students, whereas restorative justice has been shown to be a more healing policy. So now I'm going to pass over to Erin Boguski to tell you a little bit more about some of the toolkit content. Erin is the Chief of the Center for Injury and Violence Prevention at the Maryland Department of Health.
Thank you, Summer. So the part of the toolkit that I'd like to talk about is related to the social determinants of health as well as prevention. So I was really excited that our partners developing this toolkit reached out to us and allowed us to lend a public health prevention approach to key toolkit sections. So with the social determinants of health, that is where we recognize the systemic and environmental root causes within communities that increase risk for adverse childhood experiences and experiences of trauma. So this can include food access, access to safe and affordable housing, safe neighborhoods, transportation, affordable childcare, and things like that. So this section of the toolkit will allow you to explore social determinants of health and think about how to improve community conditions where we live, work, learn, play, and pray. By improving community conditions and systems, we can prevent ACEs and promote PACEs, positive childhood experiences. Okay, next I'll talk about the prevention section on the toolkit. So there are a range of prevention strategies that are proven effective at preventing ACEs and promoting PACEs. So this section will talk about the 3 different levels of prevention. And the good news is that ACEs are preventable, not inevitable. But how? So the 3 types of prevention are primary prevention, which aims to prevent harm from ever occurring. Secondary prevention aims to intervene at the earliest of warning signs or within groups at high risk for ACEs. And tertiary prevention aims to support those who experienced harm and provide opportunities for healing. And the tertiary prevention piece, all the intervention services that many of you all provide, is its own section in the toolkit. So the prevention toolkit includes the effective and evidence-based prevention strategies that exist and points to local examples here in Maryland that are being implemented. That is the end of the sections where we contributed, but we really hope that you enjoyed the toolkit, and I will put a email address into the chat if you're interested in talking more about primary prevention approaches and want to reach out. Thank you so much.
Thank you, Erin. Your guys' work on this toolkit has been amazing, and we're very appreciative. So to continue with the toolkit, we also have a section on trauma. The toolkit provides a brief overview of what trauma is, defining it using SAMHSA's definition of the 3 E's, and detailing how a traumatic event can be a single event, a chronic experience, or an event that was witnessed or talked about. All of this is explained in more detail in user-friendly graphics, such as the one that Joanna is going to drop in the chat box. There's also non-triggering examples of traumatic events that are listed for reference, as well as information and resources about collective, historical, and generational trauma. This section also makes sure to strongly emphasize that people impacted by trauma can and do show resilience, but professionals supporting them should also be sure to address other forms of oppression that harm communities and force them to be resilient in the first place. Our toolkit also includes a section on adverse and positive childhood experiences. We provide some very basic introductory information, including definitions and examples of both ACEs and PACEs. This section also includes some infographics about ACEs and PACEs in Maryland using data from the BRFIS and YRBS, as well as a full presentation on some BRFIS data that was created by Karen McNamara for this project. One of our infographics focuses on adverse childhood experiences in Maryland, in the public behavioral health system in Maryland, and how a shift to trauma-informed and healing-centered care can reduce the negative effects of ACEs. Joanna will drop that link in the chat so you can explore that infographic. And the other infographic focuses on how positive childhood experiences and how different positive childhood experiences have been shown to improve outcomes for youth who have experienced 3 or more ACEs. And that is on the toolkit, and the link for that will also be dropped in the chat. We've also compiled a lot of data resources for this toolkit. There's a set of national, state level, and jurisdiction level resources that will be helpful for organizations in their journey to becoming trauma-informed and healing-centered. A lot of resources are available for data on ACEs, mental health, trauma-informed care, and other relevant topics. Some of these resources include links to access YRBS and BRFIS data, some infographics, fact sheets, gap analyses, and more. We've also created a Google Sheet of these resources and have them categorized by location and resource type so that users can easily access relevant resources that they need. So now I'm going to pass it off to Marie Ewell, lead clinical research specialist here at the University of Maryland School of Medicine.
Thank you so much, Summer. Our toolkit also features information regarding healing-centered engagement, which is a term coined by Dr. Sean Ginwright, who is CEO of the Flourish Agenda. Healing-centered engagement was coined as a means to address harm and restore well-being. Healing-centered engagement helps systems move from a culture of harm, discipline, punishment, and confinement to a culture of restoration and hope. It focuses on 5 main principles, those being culture, agency, relationships, meaning, and aspirations. And we detail this and more about healing-centered engagement in our toolkit, including references to important individuals who have influenced the ideals promoted by healing-centered engagement, such as Audre Lorde, James Baldwin, and Maria Yellowhorse Braveheart, to name a few. We have also compiled a list of organizations in Maryland and some at the national level that offer non-traditional forms of healing. Right, our toolkit also provides resources for you to learn more about common reactions to trauma exposure, details about what to do if a reaction to a traumatic event causes problems that interfere with everyday life, along with a list of evidence-informed treatments for trauma and other resources that may help individuals find supports in their area. We also include a great deal of information about anti-racism and what it means to be anti-racist. We hope that you will use these resources to gain a deeper understanding of historical and present-day manifestations of racism, as well as how to practice anti-racism at the individual and organizational levels. Right, secondary traumatic stress. This refers to the emotional and psychological impact that professionals in helping roles may experience when repeatedly exposed to traumatic stories and experiences of others. It's something that often goes unrecognized, but significantly impacts the well-being of helping professionals. Through our toolkit, individuals can learn to recognize the signs and symptoms of secondary traumatic stress and access resources to proactively address and mitigate its effects. The toolkit provides resources and tools for organizational leaders and service providers, including guidance on identifying, preventing, and intervening when secondary traumatic stress occurs. By utilizing these tools, organizations can effectively support their staff and implement strategies that promote self-care, resilience, and well-being, as well as an environment that's trauma-informed and healing-centered. All right, so as we approach the end of our presentation, I'd like everyone to just use our chat box to enter one thing or more that you are most excited about using our toolkit for. And I do see a question in the chat. If this is being recorded, it is. All right, so people will use our data to action toolkit for everything, gathering information, education, more information on PCEs, fantastic, healing-centered engagement, evidence-based prevention tools, our data resources to be better informed, fantastic. We look forward to hearing more about what you all plan to use our toolkit for. And your data, so you can go to the next slide. Perfect. So on behalf of the Building Healing Behavioral Health Systems team at the University of Maryland School of Medicine, Bowie State, and the Behavioral Health Administration, I'd like to thank you all for taking the time today to learn more about our Data to Action Toolkit. Yordanis will put a link in the chat to our evaluation. Please note that in order to receive continuing education credits or a certificate of completion, you must complete the evaluation and provide your email address. If you have any questions or you want to get more information about our Data to Action Toolkit or our initiative in general, please feel free to reach out to Joanna and Tiffany. You can find their information here on this slide. Please also check out our upcoming webinar that's going to introduce the Trauma-Informed Organizational Assessment, TIOA, on Thursday, August 31st, 2023. And on this slide, you will see a list of resources that we've included throughout the presentation for your convenience. I want to thank everybody again.